Weight gain, muscle weakness, fatigue. They're all possible symptoms of thyroid problems.
Well, Charlotte, eye, ear, nose, and throat associates can help you determine whether your thyroid is healthy.
All right, Dr. Kelly, let's start here. First off, what is the thyroid gland?
The thyroid gland is a gland that's in the lower neck. It's just in front of the windpipe here called the trachea, just below the voice box, larynx, and it's part of the endocrine system. The endocrine system, in the easiest terms, is responsible for hormones. And the thyroid gland produces thyroid hormone. We like to keep things simple. Thyroid hormone is responsible for metabolism.
Okay. We hear that a lot of people do have thyroid problems or concerns, and you say that this is a common thing.
It's a common problem. The hormone side of things is usually dealt with by a primary care doctor or an endocrinologist. We see people for primarily thyroid tumors or growths.
Can you talk about the nodules and the growths and when they're a concern?
Nodules are very common. So first, don't get too concerned.
Okay.
We're finding more nodules. Over 50 years of age, you have about a 50% chance of having a thyroid nodule. So very common. We're finding them now because of people having ultrasounds of the neck, carotid Doppler studies, x-rays of their chest. These show up incidentally. But thyroid nodules are usually benign, but they can be cancer, so we want to determine the difference.
Is there a way that a patient would know that? I mean, would you be able to feel it, or would you have any symptoms?
You can feel a nodule, and in a situation where there is a cancer, especially if it's an aggressive cancer, they can have pain, they can have trouble swallowing, change in voice, things like that. If a nodule has been present for a very short period of time and it's growing quickly, that's of concern. But many people have nodules, they don't even know they have them. In fact, when somebody comes to me, even on physical exam, they're sometimes hard to feel because they're in there quite a ways.
Yeah, so it's not to panic anybody, but just to know that it is a common thing.
Very common.
And what is the treatment? If it is a concern, what is the treatment?
So the first thing I do is, frequently the typical patient, they'll be coming in, they'll say, hey, I had an ultrasound at my doctor's because I have carotid issues, and they found a 1.5 centimeter thyroid nodule, under around ½ an inch. I may be able to feel that, but I'm going to do a history. I'm going to talk to the patient. I'm going to ask them if they've noticed it before. Do they have a family history of thyroid cancer? If you have a first-degree relative with thyroid cancer, you have a triple the incidence of thyroid cancer in yourself. If it's changed a lot, if they've got those other symptoms such as pain and trouble swallowing, that's going to be of concern. And then a physical exam, see if I can feel anything. There's certain characteristics of a nodule we're concerned about. The bigger the nodule, the more of a concern, because it may be difficult to figure out what it is. And then they've already had an x-ray and ultrasound, so we want to get tissue, so we'll do a needle biopsy. And we can do that either in the office, or we may send them to the radiology suite to have an ultrasound-guided biopsy.
Are there other things that we should know about the thyroid?
Well, mainly that when you have a nodule, most times it's benign. 85% of thyroid nodules are not a cancer. Of those that are cancer, they're very well differentiated is what we term them. They are treated easily. They don't require anything but mainly surgery. They don't require radiation or chemotherapy, and the cure rate is extremely high. There's only a few types of thyroid cancer that are aggressive or bad. So even if you have the diagnosis of thyroid cancer, as I've told many of my patients, if I had to have a cancer diagnosis, I'd take thyroid today, because I know that it can be taken care of by surgery, and usually that's the only required treatment.
It's good to know. Thank you so much for having us here at Charlotte Eye, Ear, Nose, and Throat Associates. Great to see you, Dr. Kelly.
Thank you. Thank you for your time.
Yeah, to make an appointment at Charlotte Eye, Ear, Nose, and Throat Associates, call 704-295-3000, 704-295-3000, or log on to their website. It's goodsenses.com, goodsenses.com.
Well, good.
All right, well,